Hi again, Joe again, with another video on how to use YourClinic. In this one, we're just going to look at how patients would book, how you would book a patient, and then their intake form and medical record. So we're currently in our test practice. If you click View Practice, you'll get to see the patient's view of that practice. With all your imagery, information about it, and services. Now you can have multiple services here, you can have multiple practitioners treating. But now that you've got a subscription on there and your service and availability, they can click through to book now. They can choose which practitioner they're going to see. If there's multiple there, there'll be multiple, and whether it's initial or follow-up session. Regardless of whether you've been treating them before and whether they choose initial or follow-up, if it's their first session on your clinic, it will do the initial intake form so that you can then have that data from start. But if you're converting to this system from another one, they can, it's why they have the choice there of going to a follow-up rather than just having to start from initial cost-wise again. So we're going to do an initial one here. We're going to choose a time and a date. There's a nice little way that you can click through there, or have the months at the top, or scroll through the days of that month. And then we go next. Again, this is where the sliding scale comes in. Choose how much you want to pay. I put it on the lower end because I'm actually booking for myself as the practitioner of this clinic anyway. It won't charge me, so you can sort of run these little tests for yourselves. Click next. Submit, and that's it. It's as simple as that to book on this system. If they haven't already added their card, then they can quite quickly do that. So you can see here we've got 3 options and a bit of information about the appointment and the clinic and the practitioner. Initial intake form, initial medical form is where we'd want them to go next, but they can edit the appointment, which will take them back to the options, and you can very easily click across to a different time, date, whatever, and that'll just update all of that for you, notify the patient and the practitioner. You can quite easily cancel, or even patients can. So again, it's a really nice bit of functionality we've added in to just take the admin away from the practitioner. Again, when you do cancel here, or just double check you want to do that. If you or they do, it will automatically issue a refund there as well. And so yeah, here's the initial medical form. There's the consent form here, which they go through. Tick, click on that. Oh, sorry, my mouse is having some issues. Accept, and then we've got the MyMop form. So there's all those initial information that you expect from MyMop form. It's just 5 simple steps, so it's nice and quick. There's some additional questions around, let me take you back. Back pain, let's say it's this bad and it's been going on for this many weeks. You can add another symptom here, so there'll be 1 or 2 symptoms to track. An activity that's been made harder because of the pain, and the overall well-being. And then on top of that, that's the MyMop side. Then additionally, we've added, are there any other additional symptoms diagnosed, because 2 symptoms might not always capture it. Any medical history, desired outcome from treatment, which is required. Some additional ones around whether there's dizziness, palpitations, hotter or colder, so from the TCM side of things. You can click through to next, and it's where they heard about the clinic, really useful for marketing. Their GP surgery, which again is required. If they're on any medication, which will then pull up to open a bit more information about what that medication is. And there's on the follow-up forms, it's asked if there's any changes in there. And then these are the red flags. So let's just put a bloodborne infection. And you'll see there's a really neat red flag system. Click submit there. And then because we're logged in as the practitioner, it'll show us the practitioner view now. And you can see really big red flag right there. That'll come up every time you look at them. These are the initial details that they've put in, and there'll be these number scores that are color-coded, so we can nicely see if they change. There's a follow-up tab, which again, once they've got more forms in there, we can see appointments, any medication changes. Here you can upload documents, so if you do come across to this service from another one, you can add all the information there. and then the medical note, which is fairly simple. We've kept it as simple as possible, so it's as applicable to as many practitioners as possible. You had all your extra information there: tongue, pulse, diagnosis and treatment strategy. Pulses, you can choose between the different meridians, and it will line them all up underneath, or you can just start searching either as the sort of meridian number categorization, or as names in Chinese pinyin. If you are needling unilaterally or doing any acupoints, you can put them in here, and you can add any other notes on manipulation or anything you did with the treatment there. And there's additional one here for additional treatments. Just a quick one: if you do want to book patients in by yourself, you can go to book appointment here on the appointments page, and then it's the same loop where you can choose the patients, go across, choose what kind of service, the time and date, and that's there. So that's the end of this video. Thanks very much for listening. Again, any questions, just get in touch. Thanks a lot.